My name's Heather Walter McCabe. I'm an associate professor at the Wayne State University School of Social Work and at the law school with a joint appointment. And my primary areas are around policy and LGBTQ communities and how we can think about how it is that we can use policy to better impact health equity. So one of the ways that we can think about health equity is through the policies that we have. And I'll start with what we're going to try to do is provide a context for the current policy climate for LGBTQ communities. We're going to talk about and equities and why it relates to policy. I'm going to talk a little bit about Michigan's HIV criminalization laws because we're going to use that as an example of how policy has a real impact. And then I'm going to be quiet and turn this over to Jaron, and he's going to talk about the amazing program that LGBT Detroit has and how they're working to move forward, challenging HIV stigma. And go to the next slide. So I'm not going to go through all of these, but I do want to, just in case others aren't familiar with, mention the current climate that we are in as we talk about policy and health equity in LGBTQ communities. We've got many, many states bringing forth bills that particularly impact transgender youth. But we also have general bills that are, many of you have probably heard of the Don't Say Gay bills. It's been really talked about in Florida, but they are not the only state that is bringing forth such bills. We also have states that are doing things that they aren't necessarily talking about as LGBTQ bills, but are looking at religious freedom bills that can have a very direct and difficult impact on LGBTQ communities by allowing exemptions in healthcare, exemptions for provision of activities, exemptions for providing general services to people who are in LGBTQ communities. And so just understand that this is the climate in which we're discussing policy today. I think it's of note that Texas has even been attempting to classify provision of gender affirming care to youth as child abuse, which could actually create criminal penalties for physicians offering this care and get parents who are providing this care for their children wrapped up in the child protective services system. Next slide. And so as we're talking about health equity, why does this matter? These are just a very small sample of some of the headlines that people in the community and their loved ones are waking up to daily. And why does this matter? Well, let's look at the next slide. It impacts stigma. And it's important to think about policy as a driver of stigma because there's been now a fair amount of research on how policy itself actually drives stigma. And stigma can be at multiple levels. So it can be the individual themselves hearing all of this and developing ideas about themselves. It could even then create a situation where people begin concealing their own identities. And start believing what they're hearing from others about who they are. It can impact interpersonal levels of stigma, where we see abuse around the person's identity. We can see familial rejection, which happens often in this population, unfortunately, and just outright discrimination interpersonally. And then there's the structural level. And importantly, this is where policies come into play. We end up with state policies, federal policies, institutional policies that not only create stigma, but actually enact the stigma through their very practices. And we know through some of the research that's been done, and this probably isn't going to be a surprise to any of you who are here today, that these institutionalized practices and policies actually create conditions which have an impact on the health of the individual whose identity is coming under attack. Next slide, please. The kinds of risk factors that are impacted by stigma and discrimination are things like suicide rates. And we know, and I think it was already talked about in the first presentation, that suicide for LGBTQ populations generally are higher than the general population. For LGB communities, it tends to be about 2 to 3 times the attempt rate of the general population, and in fact, a little bit higher in bisexual communities than even lesbian and gay communities. And then for transgender communities, we actually see reported suicide attempt rates at about 9 times that of the general population. Which is more than a little bit alarming. We can see things like increased incidence of drug, alcohol, and tobacco use. We see increased STDs, including HIV/AIDS, absolutely horrendous violence numbers and rates. The picture that you see in the bottom left-hand corner is just a small representative of the Black trans women who have been murdered. And that picture is actually representative of less than 1 year. And when we look at the percentage of population that Black trans women make up, and we look at the numbers, it is absolutely alarming and is an urgent need to impact right now. Homelessness, there is a vast overrepresentation of LGBTQ folks that are homeless, particularly youth who have been kicked out of their home. And we even see delays in receiving care for cancer screenings and other in the community. So it's important to understand that these policies and the stigma that they create have both direct impacts on health equity and through stigma, indirect impacts that really have an overwhelming impact on the way that people's health is given and received. Next slide. So one of the ways that we can think about this is looking at a case study for a specific kind of law. And we're going to talk about the HIV criminalization laws here in Michigan. We know from looking at these laws that these laws, when they criminalize HIV status, and when they make it that people can, in fact, go to jail, in some states, a felony, when they engage in sexual behaviors when they are HIV positive, that it can disincentivize testing, that studies have shown that these laws really are very unlikely to reduce new infections. Enforcement is likely to be applied discriminatorily. So these laws are much more likely to be applied to Black and brown people than they are to a white person. And globally, this has even been recognized. The Joint United Nations Program on HIV and AIDS guidance state that these criminal laws should only be used in cases of deliberate, where it's deliberate that someone is trying to give someone HIV and that transmission actually occurs. Next slide, please. So we've got this information about what the laws do and don't do, but up until recently, Michigan's law actually did provide for felony consequences for people living with HIV who did not inform partners of their HIV status. And importantly, it was before any penetration. So this included penetration that was not likely to transmit HIV. And it included it included this regardless of whether they had viral suppression. It included felony of up to 4 years in prison. Post revision, the law didn't targeted is only targeting those penetrations which are anal and vaginal and more likely to cause transmission. It also requires that if the person has proof of continuous viral suppression, that they have a defense, and the level of charge is dependent on whether this appeared to be intentional and whether the transmission occurred. So the change has been made that's positive, but we still have work to do. I'm going to stop talking and move on to the next slide where Jaren's going to talk about how an organization on the ground is working on this. I'm going to skip this slide, although importantly say I put that slide in because we talk about the negatives. And I think it's important to remember this is a vibrant, wonderful community. And that's what that last slide was. All right, on to Jaren.
Thank you so much, Heather. And good afternoon, everyone. My name is Jaren Totten. I serve as social justice engineer at LGBT Detroit. I was about to give you my old title. Thanks again, Heather, for coming before me with such great information. I'd like to talk about LGBT Detroit's effort to decrease HIV stigma through a series of programs and social media campaign called Together. And this is a partnership with the Michigan Department of Health and Human Services. The project statement says, "Together we see each other beyond a diagnosis. As friends and lovers, we challenge HIV stigma. By protecting safe, brave spaces, we can live openly and play together." Let's go to the next slide. I do want to note that that Together is spelled TOGETHR. The other E is left out for aesthetics. So let's talk about LGBT Detroit. I know that some of my colleagues and our executive director have been on to talk about LGBT Detroit. I'll just follow up and say we are North America's largest African-American found and led LGBT nonprofit. We sit on the northwest side of Detroit. Originally, we were founded in 1994 as a magazine publishing company called Kick. Kick magazine was an educational resource to Black and Brown LGBT plus people, particularly those who were living with HIV in the early 90s. In 2003, we left the for-profit magazine publishing business and became an education and advocacy nonprofit organization. In 2015, we changed our name from Kick to LGBT Detroit, and now stand as the largest, as we have a 2-building campus on the northwest side of Detroit. Let's go to the next slide. So we're going to be talking about HIV stigma, which refers to the irrational or negative attitudes, behaviors, and judgments towards people living with or at risk of HIV. Again, Together is our effort to decrease HIV stigma. Our primary impact area is Southeast Michigan, but as we get into some of the programs that we offer, you'll find out that our reach has expanded beyond Southeast Michigan. We prioritize Black and Brown men who sleep with men ages 18 to 35 by offering anti-stigma programming, managing a social media campaign, hosting regional anti-stigma educational tours, and hosting an educational health-focused sex-positive event. Let's go to the next slide. The Brother to Brother Lockdown is an HIV intervention and prevention program that now takes the form of a video podcast. Originally, this program was launched to give Black men who sleep with men spaces to have frank conversations about sex, reducing risk. And so during the COVID-19 pandemic, this program kind of evolved, like I said, into a video program, I'm sorry, I was watching the chat, into a video podcast. Every 2 weeks, we have influencers from across the country talk about all things that impact Black gay men. We are currently at 133 episodes for the 2 years that we have ran this program. I have a video to show you a little bit of what this program looks like every other Thursday. Let's take a look. It is the first one, the first tab. I think we have to share the sound.
Can you hear it?
I think just have to move your chat window. We can see that.
I just wanted to make sure that I emphasize the importance of these Senate races. We cannot lose our momentum. We cannot slow down. We need to do everything in our power to get as many people out to vote in Georgia.
And so finding brotherhood wasn't necessarily hard, but the men that I have met through having a title and through traveling around with the title and have been some of the most important relationships that I've ever had.
I'm somebody that feels like all of us are different and unique in our own type of way. So just make meals and create things that you enjoy and share it with people that you enjoy.
So, I think it's important for us, people who are using these types of platforms to kind of get messages out and spread more awareness. It's truly important to spread their voice, to share their voice.
This is Mongolia.
Thank you so much. That was a look at our Brother to Brother Lockdown video podcast that happens every other Thursday. Let's go to the next slide. The next program that I'm going to talk about is the Sex Hooking Up in the Apps Tour. This program is dear to me as this program was kind of a launch pad for the entire Together campaign. In 2019, the Michigan legislature updated the state's HIV criminalization law. This effort was led by then State Representative John Hoadley, who after its passing asked LGBT Detroit to educate the state of Michigan on the updated law. With the help of the Michigan Department of Health and Human Services, LGBT Detroit embarked on a statewide tour called the Sex Hooking Up in the Apps Tour. This was a regional anti-stigma tour that focused on statewide Black and gay bi men high HIV rates. We went to 5 cities, Flint, Lansing, Grand Rapids, Kalamazoo, and Ypsilanti, and partnered with 14 different organizations. During this time, we had a 2-hour show where we talked about HIV stigma. We gave basic information and education around what it is to protect yourself from HIV and stop the spread. And then we brought up a panel of influencers again to talk about sex, hooking up, and the apps, and how this law plays into how we engage with each other in those three different areas. I have a second video that I'd like to show our experience in 2019.
more work to do.
Every day that I exist, building relationships with Window, with others, now that we're participating in polyamory, is just the bond that we build within that relationship gets stronger.
In BDSM, it's not all about just physical fucking. You got fisting, flogging, all the things. So you gotta discuss all that. Like what's okay, what's not okay.
These groups that have started themselves, LGBT Detroit even from back in the day, did not wait for permission. They just decided, oh, you won't make room for me? I'll make room for my own self. I'll create my own thing. You know, you don't like how I decide I want to have sex? I'll create my own space for have sex, how I want to have sex. You don't like my size? I'll create my own space for my size to be celebrated and affirmed. And I think that that's where everybody needs to be. Stop looking for anybody else to affirm and validate you. Validate and affirm your own self. And I think the brothers who have been part of this experience have embraced that for their lives. And that's exciting for the future.
Earlier this year, in March, LGBT Detroit also did a local sex hooking up at the apps tour with various colleges in the area. The College for Creative Studies, U of M Dearborn, and of course Wayne State were all stops this past spring for the sex hooking up in the apps tour. Thanks to the Michigan Department of Health and Human Services again, we will have a third installment of the Sex Hooking Up in the Apps Tour, spring 2023. Let's go to the next slide. The LGBT Detroit Leadership Academy for Mentors and Proteges. This is a program that we've had for about 11 years. We've had 11 classes to graduate through this program. It's taken several names throughout the years. I think the first one was the LEAD program. It's now known as the LGBT Detroit Leadership Academy. This program is led by Deontay Brown. And this is a program where we pair LGBT plus youth with mentors. They go through a series of workshops, seminars, and they hear from subject matter experts in areas like finance, professional development, storytelling. This program prioritizes youth who are impacted or affected by HIV. Again, this year we graduated our 11th class. They ended with a capstone project in which they talked about what they would do to decrease stigma in their communities. Let's go to the next slide. Final program that I will talk about is Cold as Hell. Cold as Hell is our Winter Pride event that focuses on kink and leather culture. We launched this event in 2020, right before the pandemic, and it was an in-person event. We had different rooms set up with kink experts, again, from across the country, who chose a kink or fetish to put on display, and participants were educated on kink and leather culture and also got a chance to experience various kinks and fetishes. From 2021 to now, Cold as Hell has taken place virtually, still providing education on leather and kink culture. It also decreases stigma around the various ways we experience pleasure. Let's go to the next slide. Our social media campaign is how we present our programs to the public. And so we have a great team of content creators who make sure that our programs are accessible to community members through Facebook, Instagram, YouTube, Twitter, and now TikTok. Let's go to the next slide. We are at the conclusion of my presentation. I want to thank everyone again for the invitation to share with you some of the programs and services that we do offer at LGBT Detroit. If you would like to reach us, please do find us on all social media platforms at LGBT Detroit. Our website is www.lgbtdetroit.org. And then our address and phone number are listed there for your reference. Again, thank you so much for having us.